Okay. All right. Well, we are going to start right on time because it's going to be a full session. So welcome everybody to today's Financial Friday with Saneys and Equitable. Today's topic is healthcare and retirement. Saneys is excited to offer these sessions in cooperation with our corporate partner, Equitable Advisors. Equitable has a long-standing presence in New York, and a large portion of their New York client base is built upon the work they do in the public education system. Through Equitable, Saneys members can receive competitive insurance rates and a full array of retirement services, including a complimentary financial profile for Saneys members, which we urge you to take advantage of. It's a great benefit. So joining us today, we have a few folks with us. First is Kelly DeMay, Senior Vice President for Equitable's Northern Complex. And joining Kelly today, we have Sue Alldredge. Now, Sue is a licensed Medicare consultant with 12 years of experience, and she's built her business working directly with individuals preparing to enroll in Medicare and also work with people who are already Medicare beneficiaries. She has the ability to broker through multiple Medicare insurance companies in New York State to find the best options for each unique situation. She has created a vast amount of experience working to support educators and administrators. Prior to her current role, she spent 21 years in third-party administrator field, helping to administer 403B and 457B plans. So we have a lot of expertise here with us today. And with that, I'll let you know we are recording today's session and we'll save Q&A to the end, but please use the Q&A panel and the chat panel for any questions you have as we go. So with that, I'll turn it over to Kelly and she'll kick us off. Kelly?
Thank you so much, Michelle. We really appreciate it. So this topic of healthcare and retirement is a big one. And it's an area actually Saneys gets some of the most flow of phone calls with questions about this topic, as do I myself as an advisor. And the reason it is that such and is that way is because it's a little bit different for everybody. Whereas like your New York State pension is really standardized. It's a cut and dried formula for every state employee. Healthcare is not. It's not administered at the state level. It's administered based on your contract at the local level. So what applies to one person in one district doesn't apply to another in another. To make it even more complicated, depending on your district, there's sometimes grandfathered rules in for dependent on how long somebody has been with the school. So even within the same district or BOCES or unit, you can have different rules for different people based on their tenure and experience and some other factors. So it's never a one size fits all approach, which in some ways is a good thing. In other ways that can be cumbersome. And our goal today is to go through this with you just to give you a little bit of insight as to how the moving parts work and what to be prepared for. So what I'm going to cover here today is I'm going to present on between ages 55 or at retirement to 65. So let's say someone retires at 55, I'm going to talk about health insurance in that gap until 65. Or if someone retires a little after 55, maybe 57 or 60 or 62, that's the time frame I'm addressing until 65. Sue is going to talk about after 65 when Medicare comes into play. So I'm going to take the first chunk. She's going to take the second chunk because they're really two separate sets of rules. Okay. Okay, so what my objective is today is threefold. So first of all, I'm going to talk about how your healthcare depends on, once you're retired and age 55, basically what your district is going to offer and the options within the district. I'm going to talk about how you can kind of decipher that, what that means, and what to be prepared for. We're also going to talk about the New York State marketplace. Some schools and some districts do not offer healthcare to retirees. Very common under certain circumstances. So if you go to retire and you don't have health insurance through your former employer who you work for, and maybe you're single or your spouse is retired and they don't have healthcare, what do? You go to the New York State open marketplace. That was a result of the Affordable Care Act, which is also called, in the slang term, Obamacare. And then the third thing I'm going to address today is dental, because this is a big topic. Why? Because, well, who has dental claims? people in their 50s, 60s, and 70s. So it's always a big conversation that comes up. And we're going to talk about what that looks like or not look like. Okay, so first and foremost, healthcare offerings are based on your school district and are contract specific. So if you're like, well, I don't know what my district offers, it's as simple as pulling your contract, and it will be outlined in your contract flexibility. Now, that let's assume in case one that you have health insurance offered in retirement through your school district. Okay, so hypothetical, someone retires at 55, they've got their 30 years in New York State, great. They're also retiring from the school district. They're going to resign for the purpose of retirement. Some districts, many districts, offer healthcare coverage to those in retirement. Things to keep in mind. So like I said, first and foremost, you just need to pull your contract. It'll go through the specifics. It is very common in your contract that there are date specific scenarios, meaning that if you started working for that district before a certain date, you get one set of benefits. And then another if after a certain date, because people would have been grandfathered in to current promises once they were employed. Another scenario that can play into that is some districts say you have to have a minimum number of years of service within that district to be healthcare eligible. I'm going to talk about why that's a really big deal later on in your career and something to be highly mindful of. So assuming health insurance coverage is offered through your district for retirees, you need to choose a plan that fits your needs. So what plan you're on in what your working years might not be the same plan you're on in your retired years. You might go from a family plan to just a you and spouse plan. Obviously, that has a lower cost. You might switch plans going to a high deductible plan from a PPO plan. Now, it's like anything else. You want more robust coverage for health insurance? Typically, there's that option. It's just going to cost you more. Okay. And typically people pay a percentage of that cost for the coverage. Usually you can also change your plan that you're on every year. Okay. So you get an open enrollment period. So if you elect a plan one year and say, boy, this wasn't a good fit for us, almost always you can switch plans year over year. That is rarely an issue. But you got to weigh out the costs and the benefits of that, right? Once again, this is a you get what you pay for world. If you don't want to pay a lot, there's probably a plan that offers that, but you're not going to probably get the robust coverage you might be used to. I'm not advising to do one or the other. I am merely stating you've just got to understand what's the right fit for you and be highly aware and sensitive. What the person you did and what they elected, who you worked with for 30 years and what you elect might not be the same thing. You have different medical circumstances, which will dictate different needs. Very individualized. And things to pay attention to while selecting a plan. Like it said, cost is a big piece. Prescriptions that somebody is on is a big piece. I always kind of advise people who are in the, last 5 years before retirement. I say, listen, well, you've got the Cadillac of health insurance. I want you to get every appendage taken care of. We're going to do the knees. We're going to do the hips. We're going to do all the things right now. So let's get a plan for this because you've got great health insurance through your school. Let's get all the things we can done while we still have the great coverage. Now that's easy for me to say, right? Like I'm not you and don't have a full plate of what you deal with day in and day out. However, good planning can help you prepare financially for the healthcare piece to maximize the care received while reducing the cost. What if you don't have health insurance? So there's a lot of schools that don't offer health insurance to retirees. Let's say you don't have health insurance. So you're 55 and you don't have anything through the school. What can you do? Well, the federal government made it effectively a law, or you pay a fee to have health insurance, and you would go through your health insurance through the New York State marketplace of plans. Okay. Once again, you can get a basic plan that's not going to cover a lot, but which will be low in cost. You can get a robust plan that will cover a lot and be high in cost. It is apples and trees, ladies and gentlemen. It's exactly what you would expect, but it can be cumbersome to know what to pick for you, especially if you've got some pre-existing components there. So that New York State of Health marketplace, that's where you'd go to effectively shop your plans. Okay. It is a way for people to shop, compare, and enroll in healthcare. And this is for somebody who is not yet Medicare eligible or age 65. All right. So this is in the gap of what do you do? And who's eligible for that? The short answer is almost everyone. You've got to reside in the state of New York. You've got to be a US citizen, and you cannot be currently incarcerated. Everybody can fall into the category of being eligible as long as you meet those parameters. So the good news is with this, you've got a lot of options, but my advice and guidance is you got to be really proactive with these options, right? You don't want to get to retirement and say, boy, I got to go figure out the health insurance thing. That is not a plan for success. And some of this may apply to some of you and it may not. If you have health insurance through your employer in retirement, you don't need this. But if you don't, you're gonna, okay? And we need to account for the cost and the benefits. Open enrollment for the New York State of health plans begins at November 16th. However, if somebody has a qualifying event, they can always go and use this and change their circumstances. For things like essential plans, Medicaid, and Child Health Plus, which are different circumstances, open enrollment is year round. Now, one of the big things that I see with this and big mistakes I see school administrators make. So school administrators get to the point they've worked at a school for 20 years, 15 years, whatever the case is. And they say, Kelly, I'm burnt out. I need a new district. I'm tired of the same old thing every day. I need something different. I need a new role. I want a different, whatever, right? Everybody's felt that way. We're all in good company on that topic, right? For one reason or another. I always tell people you got to be really careful with that, because in your contract currently through your current district, you've got health insurance and retirement. You go to the new district, you don't get the first district's health insurance. You walk away from that benefit. What are you getting in retirement? Because people say like, well, Kelly, the job pays $10,000 a year more. And it's like, I get that. But if it's going to cost you $20,000 a year for health insurance and retirement, that's not a good deal. Right? So recently I was meeting with a client of mine who was considering, changing roles and changing districts. And I said, respectfully, you've been in the same district for 25 years. And right now, if you retire, when you're eligible, you get healthcare and your spouse gets healthcare forever. You leave this district, you walk away from that. You can't call up 7 years later, hey, like I left the district to go down the road. You're going to still help me out with that healthcare thing, right? They're going to say, no, you left. That's on you. That was your choice. You wanted to make 10 grand a year more, remember? So you got to be really careful with those decisions because you're thinking in the moment, right? I want a new role. I want a new district. I just need change. I want more money, whatever the case is. But there's this, that could have a big negative impact potentially in the future. Now, let's say it's an apples to apples comparison. Hey, not a factor, even better. I rarely find that's the case. So just kind of some food for thought in this topic of things that I see come up quite a bit, that I'm asked about a lot and advise about a lot. So lastly, I am going to talk about dental. Let me give you the big picture on dental. It's not good. Now, why is it not good? Because like I said at the beginning, who has all the claims in dental insurance? People in their 50s, 60s, 70s, 80s, right? So if you're in the dental insurance game, It's not a place you want to play in. You want to play in the game for the younger person who doesn't have dental issues yet, right? So you do have some challenges with this. Once again, I usually advise people, everybody needs to be going to the dentist like 3 years before they retire. We need to get all the dental work done proactively we can. You think you're going to have a cavity in 5 years, let's get it cleaned up now, right? And the dentist will be happy to take care of that as well. So dental is a big deal. Typically for dental, I advise people to go on Cobra. You can go on Cobra for 18 months for dental or health insurance and just pay out of pocket. After 18 months, effectively, you've just got to go pick up a plan in the open marketplace. But those plans do not cover very much. Usually they cover only a small percentage of costs. Most of those costs comes out of pocket. So the good news is there's something. The bad news is it's not much, but there's no real alternative. It's just something we need to factor in. So I don't mean to be a downer with this topic. However, it is what it is. A last component that I just want to address is, what if somebody moves out of state? So this comes up a lot. Hey, I want to move to Florida. What does that mean for health insurance and dental? It's a whole nother animal. Why? Well, insurance companies in New York State, insurance companies in Florida are not the same companies, not the same benefits, not the same billing. And Sue is going to talk about that a little bit as well. So is it a problem to do that? No, people do it every day. Nothing wrong with it at all, but you got to know what you're signing up for. With that, I just have one more slide. As you all know, if you've been on my webinars before, my good compliance people make me put up this critically important disclosure slide. So just take a minute. If you need just a quick shut-eye nap, go ahead and read through it. And then we'll pivot to Sue to talk about what happens once everybody in the US gets to age 65. It's funny, you know how you hear like, boy, we need universal health care. Ladies and gentlemen, we have universal health care. It's called Medicare. Everybody gets it at age 65. You just have to be age and old enough to get it. But we do have universal health care. It's just in the form of you got to be a certain age to get it. So Sue, I'm going to pass the baton to you and have you take it away.
Okay, perfect. Thank you, Kelly. I'm just going to switch my screen here. So just give me a minute. Can you see it?
Not yet, Sue.
Not yet. Okay.
We can see something. I don't think it's your PowerPoint yet. So try to reshare, click share screen again, and then see if you can choose your PowerPoint.
Okay. Let's see.
Or maybe I'm just seeing the Saney's logo because.
Yeah, the Saney's logo is me.
Okay.
That's all you're seeing. Yep.
Okay.
The juice. There we go, Sue.
Good.
Oh, let's see here.
So,
Okay.
yep. So, yep. Now just press the present button at the top next to the finger, and you should be good to go.
Let's see. I'm not seeing the finger.
It's to the left of the finger, so it's like the upper left part of your ribbon. Other side. Right next to that little finger pointing, almost, just to the right of that. Yeah, that's
There.
it. Yep.
You know what? I got like the band at the top there where it's blocking it.
Oh, I see. You
So
can
Sue, if
also
you go to the
access
bottom
it.
right,
Yeah,
in the bottom right corner as well.
to the left.
To the left.
Okay. I'm so sorry.
That is okay. Go back to the bottom right, and then it was just to the left about 1 inch over. There it is. We got there. And then actually you're sharing the notes screen. So let's see, can you switch what is being shared one more time? So if you press the share screen option.
Okay.
on Zoom, you should be able to reselect your PowerPoint,
Oh, goodness.
the green button.
Okay. And then click.
If you can find a PowerPoint window to share that has just the title slide. Maybe stop sharing and then try to reshare again.
Hey, Allison, if
Okay.
you have the PowerPoint, do you want to share it and advance the slides?
Yeah, let's do that.
Okay, yeah, let me just grab it from my email. And if you want to get started, Sue, I will pull it up shortly.
Okay. It's a good idea. I apologize.
It's okay.
It worked so well when we practiced earlier.
I know. And I am pulling it up now, so just one moment. Okay, let's try it again. And tell me when you can see the screen.
I can see it, so that's perfect.
All right. So I'll try to keep up with you. Just tell me if you want me to advance.
Okay, wonderful. Well, first of all, just to reiterate, my name is Susan Alldredge, and I just want to thank you all for taking time out of your day to meet with Kelly and I. And I just greatly appreciate this opportunity to be able to share with you about Medicare and how it relates to you in planning your health care and retirement. For many of you, Medicare is a new language, and it starts off with a lot of terms and abbreviations. So I'm really going to help you today to pull that all together, do it in a very easy, straightforward way that's going to provide you with some really strong foundations to understanding what Medicare is about and when to apply. So this is just a brief outline of what we're going to go over today. So we'll define what Medicare is and who is eligible for it. Then we'll talk about Medicare and how it affects you and how you need to plan for it when you're working past age 65 and approaching 65. There's a lot of different options that go along with Medicare that are going to provide you additional coverage, which I highly recommend, and we'll talk about shortly why I recommend them. So with that, let's proceed. So what is Medicare? We go to the next slide. Thank you, Allison. Medicare is a health insurance for eligible U.S. citizens and legal residents. Medicare currently serves more than 62 million people in the United States. Medicare is defined in part by Medicare taxes paid through employees and employers through the FICA insurance. Medicare is an individual insurance. This is probably one of the biggest misconceptions when I'm meeting with people. Once you turn age for Medicare and you go on Medicare, it's an individual plan. Medicare is not free. You will have some cost associated with it, which we will also cover here shortly. Finally, Medicare is different from Social Security. It's also different from Medicaid. Medicaid is a health insurance for people with limited income and resources. There are some common misconceptions about Medicare. So let's go over a few of the basic facts about it. Who can get it? You must be a US citizen, a legal resident, you must live in the United States for at least 5 years in a row, including the 5 years just before applying for Medicare. You must also be age 65 or older. If you're younger than 65, you would have to have a qualifying disability for a minimum of 24 months. Any age with a diagnosis of end-stage renal disease or ALS would entitle you the opportunity to be on Medicare. Next, do I need Medicare if I plan to work past 65? Well, this is a big topic, so let's drill it down because I'm sure many of you may be thinking about this very thing right now. There are two scenarios when considering enrollment into Medicare when turning 65. So the first one, generally people who turn age 65 and are choosing to work past 65, there's two things to consider when looking at this. If your employer has 20 or more employees and the employer's health coverage is considered credible, you can continue to stay on your employer's insurance and you would not need to apply for Medicare Part A and B. If your employer has less than 20 employees, you have to enroll in Part A and B and go on Medicare. And at that point, the employer's coverage is not considered credible. A lot of you may be asking, what if I'm covered under my spouse's employer? If this is the case, you may be able to delay going on to Medicare, but you first must understand what your spouse's coverage provides you through their employer. Some employers may still require you to go on to Medicare at age 65 to enroll. Go to the next slide. There are some important things to know about getting Medicare when you continue to rework. First, Medicare and your employer insurance can work together. Medicare will typically be your secondary to your employer's insurance until you leave your employer or lose the employer insurance, whichever happens first. Then Medicare will become your primary. Second, if you take any part of Medicare, you will no longer be able to contribute to your employer's health savings account. So this is something that you really want to plan out and make sure that you're aware of. A lot of times when I'm teaching educational seminars on the basics of Medicare, this is a piece that is overlooked that a lot of people are not familiar with. So if you have a high deductible plan right now that you are contributing to an HSA, you would want to stop contributing to the health savings account 6 months prior to going on Medicare. And this includes Part A. If you would contribute the money that you contributed to your HSA, that 6 months before going on Medicare would actually become taxable income, and it would be adjusted accordingly when you file your taxes for the year you contributed. Let's talk about what does Medicare cover. Go to the next, one more slide. Thank you. So Medicare is broken down into two parts. Part A is hospital insurance. Part A helps you pay for hospital care, skilled nursing care, home health, and hospice care. Part B covers doctors and outpatient care, such as labs, diagnostic services and tests, ambulance service, preventative service, and observation status if you are at a hospital. It's important to note that Part A and B both have a deductible, and it provides an 80-20% coinsurance arrangement with no maximum out of pocket. So what I mean by that is, let's say you had a bad medical year and you incurred $100,000 worth of medical expenses. You would be responsible for 20% of that after the deductibles, and there's no ceiling. So you would continue to pay that 20% for the full amount of your cost. We'll go to the next slide here. Thank you. Part A, hospital insurance. So let's mention some key pieces about this. Part A does have a premium, but few people have to pay it. If you or your spouse pay 10 years or more of FICA payroll taxes, you are exempt from the Part A premium. You can't be denied Part A coverage regardless of your health status. Part A provides national coverage, which means you are covered at any hospital in the country that accepts Medicare. Part A coverage and costs are based on benefit periods. A benefit period when you're hospitalized begins the day that you're admitted to the hospital and ends after you've been out of the hospital for 60 days in a row. There is a lifetime reserve days that you can access if you were in the hospital more than the allotted days. These days are extra, and you can pull upon them to fill in those gaps. The 60-day lifetime reserve days, though, cannot be used more than once. Some fast facts about Part B. Part B has a monthly premium. If you're receiving Social Security, Railroad Retirement Board benefits, the amount will automatically be deducted from your Social Security check each month. Otherwise, you will receive a quarterly statement. Just as with Part A, you cannot be denied coverage regardless of your health or financial status, and you may see any provider in the country that accepts Medicare. Finally, Part B does have a penalty for late enrollment. So it's very important that the timing of enrollment in Part A and B is carefully looked at. Okay. Options for coverage, and I'm having a little trouble here too. With my screen, it just blinked out on me, so bear with me. Okay. So Allison, I kind of lost it a little bit. Are we on option 1 and 2?
Yes.
Okay, perfect. Thank you. Okay. So when we talked about Medicare, we discovered that there are some gaps here with being just on basic Medicare Part A and B. So we're going to go over some of these options to fill in. So option 1, when we look here, includes adding Medicare Part D. So D stands for drug. Part D is actually required by Medicare. So this is something that you have to have. With that, there's 2 ways that you can obtain Medicare Part D. You can get it through a standalone prescription drug plan or with a Medicare Advantage plan. A lot of times it is incorporated in an Advantage plan. So to continue with option 1, you could also enroll in a Medicare supplemental plan, which is often referred to as a Medigap plan. Medigap plans have 10 different plans that you can choose from, and it supplements the care that you're receiving under basic Medicare. The next option is a Medicare Advantage plan, and this is the most popular option that individuals, once they become Medicare beneficiaries, choose. The basic benefits of an Advantage plan is it's going to give you a ceiling on your maximum cost out of pocket that you may experience. It's going to bring those co-insurance down to a much more manageable co-payment arrangement. And a lot of Advantage plans also provide additional ancillary benefits. Let's take a look now at Part D prescription drug coverage. There's 2 different ways to talk about this. I talked a little bit about it on the slide before. You can get this as a standalone plan, which you would have to do if you were going with just basic Medicare, or if you chose to also enroll in a supplemental plan. Again, a lot of Medicare Advantage plans do include prescription drug coverage. However, there are some that do not. So this is something that you have to be aware of when you're choosing a Medicare Advantage plan. So the next slide, a little bit about what Part D covers. The types of drugs that are most common that they need to list are located in what is called a formulary that identifies the drugs that Medicare does require these prescription drug plans to cover. And it will also have a listing of generic and also brand name drugs. Plan, excuse me, the prescription drug plan does not cover all types of shots. That's where Part B comes in. So shots that are covered under Part B are like the flu shot or pneumonia shot, as an example. Okay, if we look at the slide where it talks about during the year, you go through different stages.
Okay, we're there.
Are we there? Okay,
Yep.
Perfect. All right, so let's take a look at this. And this is one area that can be very confusing to a lot of people. It's probably the area around the coverage gap and the donut hole that I get the most questions on. So let's start out and look at the 4 coverages and how they work. You can see that most stages do have a dollar limit. So starting January 1st, so when you go on to Medicare, you run on a calendar year. So some plans have an annual deductible. The annual deductible usually applies to drugs that are located in a tier 3, 4, or 5 stage. Tiers 1 and 2 do not typically have a deductible. So let's say your plan does not have a deductible, so you go right into the initial stage. You stay in this initial stage until your retail cost of drugs reaches $4,430. And this limit in these stages are applicable to 2022. So each year, Medicare establishes the dollar limits for each of these stages. So it can vary. So again, the important thing to remember here is that $4,430 applies to the actual retail cost of that drug. Once you hit that limit, then you go into the coverage gap. And I like to point out here that typically we find through historical data that less than 20% of individuals will ever go into the coverage gap. Where we see this, where people have a tendency to go into it, is if they're on brand new drugs that have hit the market that are classified as tier 4 or 5 drugs, or if they're on cancer drugs. There are ways that we can prevent an individual from going into the donut hole or delay it for several months. This is where it's of great benefit for you to consult with a Medicare representative that really can help drill this down for you, compare several plans and their Part D coverage, and explain how we can prevent you from going in. Last stage is the catastrophic age or stage. And when you're into that, as with the coverage gap, you pay a different percentage. You come out of those co-payment arrangements. Okay, let's go to the Medicare supplemental insurance. We're kind of going to swing back a little bit, and I'm going to just share with you some quick facts about Medicare supplemental plans. And typically I like to point out, I usually only recommend supplemental plans to individuals that have more serious, more chronic medical needs, such as if they do have cancer or a illness that is requiring them to have several visits a week or a month in going to their doctors. So Medicare supplemental plans help to pay for some of the out-of-pocket costs that come with Medicare, like deductibles and coinsurance. They can be used with the original Medicare, but they are not allowed to be used with a Medicare Advantage plan. There are 10 plans which are labeled with letters, just to make this a little bit more confusing, right? There are plans A, B, C, D, E, F, G, K, L, M, and N, all which have different levels of premiums. Some have deductibles and some do not. And the cost and the services do vary by plan, and the pricing actually varies by state and by zip code. Just a key reminder, with those, you would have to have a Part D prescription drug plan included with this. Supplemental plans do, oops, that's okay. Yeah, they do not cover prescription drugs, routine dental, vision, hearing care, eyeglasses, contacts, hearing aids, a lot of those extra things that we do look for when we're getting additional insurance for Medicare. So I just like to point that out. Okay, next slide. Thank you. Medicare Advantage plans. So like supplemental plans, you must also be enrolled in both Medicare Part A and B and live in the plan service area. Now, there are Medicare Advantage plans that do allow you to go out of your area and out of state. And those are regional PPO Medicare Advantage plans. So a lot of us living in New York State, if we have the opportunity to get out of here in the winter and get some sunshine, we like to do that. So this is something very key to consider when you're looking at a Medicare Advantage plan. Like the supplemental plan, you cannot be denied coverage based on current financial or health status, including any pre-existing conditions that you have. As we mentioned, they do have provider networks when it comes to your hospitals, pharmacies, and your care that you can receive. Many do charge a monthly premium, and there's premiums for Medicare Advantage plans as low as a zero premium up to a couple $100s. So it's really important to look at what you're getting for those premiums. And I always encourage my clients, don't just look at what the premium is, look at the co-payments and those additional benefits that you're receiving. They do provide an annual limit on the out-of-pocket cost. Again, we talked about this with basic Medicare. It does not have that maximum out-of-pocket cost, but Advantage plans do. It brings that ceiling down so that you know, worst case scenario, what your medical costs could cost you during a plan year. Again, most plans do have a prescription drug coverage, but not all. So be very careful when you're choosing an Advantage plan that you do have one that includes it.
Hey, Sue, in the essence of time,
Yes.
we're going to progress so that if somebody has specific questions, they can submit in the Survey Monkey we're going to send out if we can address specific things, okay?
Okay. Let's jump forward. Yeah, this is a great spot. So let's go to the next slide. So the key thing, as Kelly had shared on her side, being under 65 is timing and the importance of it with your needs. That is going to be the case too when you are approaching 65 or if you're working past age 65. So this is the first example with enrollment periods if you're going to be retired at 65. So with that, you have 3 months prior to your 65th birth month, the month of your 65th birthday, and 3 months after to enroll in Medicare. And that's parts A and B. And that's very crucial. If you miss that window, there will be penalties that are associated with Part B, and they can be very steep. We'll jump to the next slide. For those of you that are working past 65 and will be carrying your employer or a spouse's insurance if eligible, once you lose that coverage, you go into what we call a special enrollment period. So your Part A and B, you've delayed until this point. You will have 8 months to enroll in Part A and B or both when the situation arises. You will have the first 2 months to enroll in a Medicare Part C or B prescription drug plan. And that 2 months is triggered by the effective date of your Part A and B. Then you have 63 days to enroll in a standalone Part D prescription drug plan if your Medicare Advantage plan does not include one. Again, if you miss that 63-day mark, there will be a penalty that you will have to pay each month for the rest of your life based on how long you went without Part D coverage. So this is just a summary, a little bit of the late enrollment premium penalties that we have talked about throughout the course of the presentation. And you can see that they do apply to all parts, both part A, B, and D. When can I change my coverage? So this is referring to you're already now enrolled in Medicare. You've been going along comfortably with what you have, but it comes up where you're looking at the new plans that are coming up for the following year and you would like to make a change. Or maybe you have a special circumstance throughout the year. So we won't spend a lot of time on this. These slides are going to go to you. We also have a handout enrollment book that you're going to receive that goes into it. And I'll just leave it at that. Thank you so much.
All right, thank you so much, appreciated. In the chat, we put a link to a Survey Monkey. So if you could please do us a favor and click that Survey Monkey link that Allison had sent out, that is going to lead you to a page that if you would like to have a one-on-one consultation regarding Medicare or pre-Medicare, you have the ability to let us know. It also allows for some feedback. I know this webinar was a little longer than typical, but obviously you can see it's a very meaty topic and it just needs a little bit more time. With that, Michelle, I think we're good to go. So I'm going to turn it back to you.
We are. Well, thank you, Kelly and Sue and Allison for your help. And yes, we'll follow up this webinar with the recording and additional resources that will be sent your way. Thank you all for joining us.
Thanks so much, everyone. Have a great weekend.
Bye-bye.
Thank you. Bye-bye.
Bye.